On Friday, the last people on the Ebola watch list in Dallas are expected to be cleared.
And now that it appears the deadly virus is gone from North Texas, leaders on the front lines of the fight gathered tonight to look at how things were handled. Fox 4's James Rose was at the public forum, and James, this really kind of seemed to be more of a meeting to help people learn from what Dallas did, right?
Yeah, pretty much that was it. I mean, it was a public forum. It was more of a reflection and discussion about what went right and what went wrong in dealing with the first ever Ebola patient in America. Now, nearly 300 students and members of the public came to hear what the men and women on the front line of the Ebola defense had to say about lessons learned. And many had questions of their own for the panel, such as how prepared are we for more cases, and just how well trained in protective gear were the two nurses that contracted the deadly disease but survived. Panel members say it was a balancing act, especially for schools where kids had some sort of contact with one of the three Ebola patients.
In retrospect, we would have drilled more, we would have simulated more, and reinforced and prioritized Ebola-specific data as we were looking for a disease that's never in the history of ever, as my kids say, occurred in the United States.
There is a balance between following the science exactly and then making sure that the people that their concerns are heard and at least somewhat met. For example, we probably didn't have to take the students out of the 5 students out of the schools. The science would say you don't have to do that. They're not symptomatic.
Now, Texas Health Presbyterian says it is compiling all the information about the caring for Duncan and the 2 nurses who contracted the deadly virus from him to better help other hospitals prepare who may be facing the same thing. They say we can expect to see some of that out in peer reviews just after the first of the year in medical journals for other hospitals across the country to learn what went right and what went wrong over here. Now, Dr. Dan Varga did say early on, he said they were definitely prepared at Texas Health Presbyterian to treat a patient that walked in that was diagnosed with Ebola. Where they apparently fell short was making the diagnosis themselves. Heather?
A lot of lessons learned. James Rose live tonight. Thank you.